5 piriformis stretches. How many of us have type piriformis? This muscle right here is your piriformis, and this can cause all kinds of issues in your glute and also issues with sciatic pain. So let's get right to it. My favorite is the figure 4. So this one, you cross your ankle over your opposite knee. The position of your knee, whether it's up here or down here, doesn't really matter. So you can let that be depending on your hip mobility. You're going to bring that leg up, the opposite leg up, and put your hand behind your knee so that you can use your arms to gently pull your knee towards your chest. When you're doing this stretch, you should feel it in the back of the hip that's crossed over. So you should feel it right here. You should feel it in your piriformis right here in the back of your hip. You should not feel anything pinching in the front. If you do feel something pinching in the front, see if you can adjust your knee to come up towards your chest or a little bit down to find a position where it's not pinching here. If you can't get a stretch in the back here or here with this particular stretch without pinching in the front, then don't do it. It's not the right stretch for you. My second favorite one is the windshield wiper. So if I'm still stretching this leg, you would let that knee, my foot out to the side, let that knee fall in towards the middle, and you can take your opposite leg and foot and put some overpressure here. This will kind of stretch, it actually stretches more of the deep hip rotators, which I'll show you on the model in just a second. But this is a really great one to work on those rotators. These rotators, actually, their job is to rotate your leg out. So we're just moving it inward, the opposite direction that those muscles are intended to stretch. Another fave is a crossover stretch where you take a straight leg and bring that over your body. This one oftentimes will stretch your low back as well. Sometimes it's just like whatever is the tightest gets stretched. You can take your opposite arm and bring it back to open up your chest and your pecs at the same time and kind of feed 2 birds with 1 stone. But this will oftentimes feel like a stretch in through here along this area. Sometimes, like I said, your low back as well. So this can just be held in this position to release tension. That's stretch number 3. Stretch number 4 is a release. So you use a ball, the hip flexor release ball, to put on the back of your glute. So this is on the side of your tailbone. And by putting prolonged pressure on a muscle is another way to get a muscle to relax, actually the most effective way to get a muscle to relax. So once it's in this position, you can let your leg fall out a little bit to the side, which is another great way to kind of get pressure onto that muscle, and then hold that. Once you find a really juicy spot, hold that position for a little bit. This muscle is, again, right here in the back of your glute. So this is the back, your tailbone is here. Right to the side here is where the piriformis muscle is. So when you're placing the ball, you can feel where there's bone and then it's flesh. It's right in that fleshy spot here that you're placing the ball. So not on your tailbone necessarily, but next to your tailbone in that fleshy spot. And there's a little bit of real estate to move it back and forth this way to find where it's really juicy. The last and 5th stretch that I recommend is working again using a ball on these deep hip rotators. These are a little bit lower. This is your sit bone, where you can feel your bony butt stick out in the bottom. And then this is the outside of your hip, the bone that's right here. So somewhere between your sit bone and the outside of your hip are these deep hip rotators. If they're tight, the piriformis is not going to relax. If the piriformis is tight, these guys are not going to relax. So it's important to address these also. The best way to do that is to take a ball. It could even be a smaller ball in this, but this will work. Place it kind of between your sit bone. And so my sit bone is here. The outside of my hip is here. So somewhere in between those two. And then I'm using my hands to kind of balance, and I'm rotating this leg out a little bit this way, which helps me to kind of target that area and put pressure on that area. And I'm in an upright position versus lying down. It's hard to get to these guys lying down because of their location being a little bit lower. But you can roll around till you find where it feels really tender right next to that sit bone, and that's your deep hip rotators. And those will be very happy when their tension is released through prolonged pressure. Like I talk about with the hip hook and like I talk about with the ball, it's important to hold this pressure for 30 to 90 seconds at least to allow the muscle to relax, even though the tendency is to want to roll and be rubbed because it feels good and it feels tight and it feels like you should. It's actually not as effective than just holding that. And it's super fascinating to see what happens to the muscle over time as you're holding that pressure. You know, as you're holding that pressure, it should become less and less irritated, less and less tight, less and less sore. And that's a sign that your muscle is waiting for you to give that prolonged pressure. So all of these stretches are really great at helping to release the tension in the back of the hip that can be contributing to piriformis tension, that can be contributing to piriformis syndrome, sciatica, and the like. But last but not least, it's important to know that oftentimes the main reason why this muscle gets tight in the first place is because tension exists in the front of the hip. So tension in the iliacus or the psoas that can be solved by the hip flexor release ball or the hip hook can really make a big impact. If that tension is released, it's not playing tug of war with the piriformis, and then it has really no reason to be tight in the first place.